Hi everyone, I'm Dr. David Bernstein. I wanted to welcome you back to our series, 25 Tips for Working with Modes. Now, last time we learned how to walk the walk with modes. In other words, how to adjust our interventions depending upon which mode is active right now at this very moment. And today we're going to go one step further. We're going to learn how to dance the dance with modes. What do I mean by that? Well, working with modes can be very challenging. It can really be a struggle sometimes. Modes can take over sessions, dominate sessions, can lead us to feel very helpless, very frustrated. And so the question is, how do you change a struggle into a dance? Kind of therapeutic dance with modes that is more effective for the patient and also leaves us feeling better and leaves us feeling more effective. Well, first of all, I think it's important to acknowledge that this is not easy to do, but it is something that you can learn how to do, and there are certain kinds of steps that you can follow. Let's take an example. Let's say that your prospective dance partner is this mode, the self-aggrandizer mode. Now, how many of you have encountered this mode in some of your therapy sessions? Well, I'm assuming quite a few of you. And, I'm sure you know that dancing with this kind of mode is not easy. This is a dominant mode that wants to take over the session and, be the boss of the session, dictate the terms of the session. So, how are we going to go about dancing with this mode? Well, the first thing that we have to do is we have to meet this client where he is. And that may not be easy because these kinds of modes push our buttons. And, that naturally can lead us to sometimes, flip into modes of our own, maybe even just wanting to kind of, throw up our hands and give up or run away. And so actually what we need to do is the opposite of that. We need to approach this side of the patient with some curiosity and interest. And that means, in a certain sense, trying to rise above our own emotional reactions and get to know this side and, to say something to the patient like, I see this side of you sometimes that, really has a lot to say, and so much so, that doesn't really leave me much of a chance to go, to get in a word edgewise with you or to really engage in a kind of, discussion with you. And I want to go and get to know this side of you better, because if this side of you is so prominent in the sessions, there must be a reason for that. This must be a very important side of you. And so then, we can then ask, the client a series of questions about this side in order to get to know this side better. And one ways to do this is to actually interview this mode, to use a kind of, empty chair technique or a multiple chairs technique and, put this client, the side of the client on a chair and ask him a series of questions about this side of him. Ask him to sort of play the role of this mode. And then find out more about, the origins of this side. Where did this side of you come from? What were the circumstances in which this side of you developed? What's the function or purpose of this side of you? What does it do for you? What are the advantages of this mode? All modes have advantages, otherwise patients wouldn't use them. So, what are the benefits to you for having this mode? And only after going through this question and really trying to understand, this mode from the inside out, as the patient experiences it, can we finally get to the question of, are there any disadvantages of this side for you? So in doing this process, we're understanding this mode much better. And by doing so, we are on the one hand better able to work with the mode, and we're also helping the patient to start to develop also some awareness of this side because, a dance involves two people. So, we also need to, in a sense, teach or train this patient, this mode to dance with us. Okay, now how further? Well, if we're going to learn to dance with this mode, we're also going to need to confront it sometimes because these are modes that can, engage in behaviors that can make life very difficult for other people, including for us as therapists. So on the one hand, we're going to need to confront the patient's behavior, but at the same time, we need to do it in a way that accepts the reasons behind this mode, accepts the fact that these modes are an expression of some underlying needs that patients have. And even though these modes may represent dysfunctional ways of coping with those needs, nevertheless, underneath that, there are needs. Like in the case of the self-aggrandizer mode, maybe that underneath there's a lonely child side that just needs some recognition and attention and admiration. Or maybe underneath the fact that, this mode can be very dominant. There is a very frightened child who feels unsafe and feels the only way that he can be safe in the world is to take over and dominate situations. Okay, so if we can approach this mode, if we can confront this mode on the one hand by being very clear and direct about the behaviors that we're seeing, including what some of the negative consequences of those behaviors are, but at the same time, accepting and empathizing with the fact that there are real needs and legitimate needs underneath that drive these modes, that even drive these very challenging behaviors. Now, sometimes simply confronting the mode by saying, I see a side of you that is not enough. And why is that? Because these modes can be so powerful and they are so self-reinforcing because of their advantages that it can make it very, very hard for us to change the modes. And so sometimes we actually need to set limits on these modes that are interfering with therapeutic process. And here I'm not just talking about setting limits when modes cross our boundaries, leaving us feeling unsafe or disrespected. I'm talking about setting limits on modes that interfere with the therapy, that interfere with forming a productive therapeutic relationship. And so sometimes we have to literally stop the patient, sometimes even in mid-sentence, in order to gain some room and some time. So we have to say, hey, John, stop. John, I need to just have your attention for a moment. I see this side of you, John, right now, this side that we've been talking about lately, the side that kind of needs to take over the session and, it's talking a lot. And I know you have some important things to say, and I want to hear them. And yet I see very much this side of you right now that really, in a certain sense, doesn't want to let me in. Okay, so this is a combination of limit setting using the stop technique and then immediately going over to empathic confrontation, confronting the behavior that's getting in the way, but in an empathic way that acknowledges the need that's underneath. Okay, now you've already made some progress today in understanding how you dance the dance with modes. But we can even go further to help you to know even better how to dance with modes. Well, anytime you're going to dance, you need to feel the music. And so that's going to be our topic for next time, feel the music of the modes. And finally, I wanted to invite you to come to our website, www.imodes.com, and take a look at our image-based therapy tools. Okay, have a great week and see you next time.